There are 28 bones in the skull, of which 14 bones are in the brain box called calvaria, out of which 3 pair ear ossicles. 2 are the parietal bones, 2 are temporal bones, 2 malleus, 2 incus, 2 stapes, 1 frontal, 1 occipital, 1 sphenoid, 1 ethmoid bone. The facial skeleton is composed of 14 bones. Now you can see the facial skeleton from front to you, of which 2 are maxillary bones, 2 are zygomatic bone, 2 are nasal bones, 2 lacrimal bones, 2 palatine bone, inferior nasal concha 2, 1 is mandible, 1 is vomer. The sutures and the points, you can see the bregma is the anterior point and the lambda is the posterior point. Anterior suture is called as coronal suture, and a vertical central suture is sagittal suture, and posterior it is lambdoid suture. The junction of parietal Pyramid is a junction of frontal bone, greater wing of sphenoid bone, squamous part of temporal bone, and the parietal bone. Anterior middle branch of middle meningeal artery is very closely related with the tibial. Is the inferior part of the skull. From here you can see central is the foramen magnum. Then you can see the mastoid process, and in the center is pharyngeal tubercle and various foramina and the structures passing through that. The central palatine surface, behind that you can see in the pink color horizontal plate, then the vomer in the same greenish color. You can see from the base of skull, anterior cranial fossa, middle cranial and posterior, the various foramina. From the olfactory foramina anteriorly passes the olfactory nerve, then optic nerve and optic artery passes through the optic canal, which in the lesser wing of the sphenoid bone. Then below that is foramen rotundum, through which passes maxillary V2. Then below that optic canal there is orbital fissure. The foramina oval is behind the foramen rotundum, through which passes called as MALE, foramen ovale, mandibular branch of trigeminal nerve, that is V3, accessory meningeal artery, lesser petrosal nerve, emissary veins from foramen ovale, and foramen spinosum passes from this foramen spinosum is middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular nerve. Then there is foramen spinosum. After that there is internal acoustic meatus, through which the important structure that passes is the facial nerve, vestibulocochlear nerve, vestibular ganglia, and labyrinthine artery, and the large foramina called jugular foramina, through which passes the glossopharyngeal nerve, cranial nerve, that is 9th cranial nerve, 10th cranial nerve, and 11th cranial nerve, vagus nerve and accessory nerve, internal jugular vein, inferior petrous and sigmoid sinuses. From the hypoglossal canal passes the hypoglossal nerve and ascending pharyngeal artery. Then foramen magnum, vertebral arteries, medulla oblongata, 12th cranial nerve, dural veins, and anterior and posterior. From the superior orbital fissure, the passes oculomotor 3rd, 4th, 5th, and 6th nerve. Oculomotor, trochlear, and 5th nerve, trigeminal, the branches which passes is ophthalmic division, of which lacrimal, frontal, nasociliary branches, then superior and inferior ophthalmic vein. Here you can see the relation of T10 with middle meningeal artery, which is very large. Of skull, and you see the muscle attachments on the posterior side. You can see occipitalis, trapezius, and sternocleidomastoid. On the right side, you can the label is there. Trapezius and sternum is supplied by 11th cranial nerve. Occipital is supplied by 7th cranial nerve, facial nerve. Then digastric posterior belly on Then ventral rami of the cervical nerves and cervical plexus, long capitis, rectus capitis. If you see stylohyoid on the right side, seventh cranial nerve. Then anteriorly at the zygomatic arch, you see the muscles of mastication as well as temporalis masseter, lateral pterygoid, medial pterygoid, supplied by fifth cranial nerve. Then styloglossus muscle is supplied by 12th cranial nerve. On the left side you can see the labels. And stylopharyngeus by ninth cranial nerve. Then dorsal rami of cervical plexus, longus capitis, plenis capitis. Some part is supplied by ventral rami and some part is dorsal rectus capitis. This is an important structure passing to foramen lacerum, that is internal carotid artery with the venous and sympathetic plexus around it, and the greater petrosal nerve unites with the leaves the foramina to form the nerve of pterygoid canal. Here you can see the foramen rotundum, superior orbital feature above that, optic canal, foramens ovale, spinosum, then greater and lesser peroneal nerve, squamous temporal bone, groove for medial vessels, and the pterion from inside. These are the diploic veins which are showing connected beyond the skull with the superior sagittal sinus. This is the mandible bone. You can see the head, neck, and the lateral ligament, that is condylar process, and the ramus, and there is mental prominence, incisive fossa, mental foramina, alveolar process anteriorly, and the oblique. There is the angle of mandible, sternomandibular ligament and angle. If you see the muscle attachment on the outer surface of the mandible is masseter, is the muscle of mastication which is appearing in blue. Then platysma, facial artery is at the angle of mandible. You can see depressor ankle, depressor inferior labis, mentalis, and buccinator. And blue color, these are temporalis and masseter. The inner surface you see the medial pterygoid, temporalis muscle, the blue color, and the mylohyoid, and the lingual nerve is passing near the angle, and mandibular foramen canal, through that passing is the inferior alveolar nerve and artery. Then you at the condylite process, condyle of the mandible, you see superficial temporal artery, which is a branch of external carotid artery and maxillary artery. This division external carotid is dividing into superficial temporal and maxillary artery. Process from the posterior, you can see the lesser wing, the greater wing. In between the two wings there is superior orbital fissure, and then the downward there is scaphoid fossa, pterygoid fossa. The attachments of the hyoid bone. This is the bone from anterior side. The green color you see the pretracheal fascia. Behind that is sternohyoid muscle. Then there is investing layer, and by the side of sternohyoid there is omohyoid, and there is investing fascia. And behind the investing fascia there is mylohyoid, genohyoid, and genoglossus in the central side. And laterally you get a thyroid muscle, then stylohyoid muscles. Then in the brown color you see the hyoglossus muscle and middle constrictor of pharynx. Posterior, the lesser kernel you get the stylohyoid ligament. On the right side you see the lateral view. The anteriormost part is the investing fascia, which is attached to the mandible anteriorly, then the hyoid bone in the center, then behind that there is stylohyoid, and again behind pretracheal fascia, then thyroid cartilage, then in between thyroid cartilage and the upper superior corner of the hyoid bone is attached, then hyoepiglottic. From hyoid bone to the epiglottis there is another ligament, and you can see from hyoid bone to the mandible the muscle, the tongue lower muscle, that is genoglossus muscle, which is attached, and below that there is mylohyoid muscle. This is the arrangement of the cervical vertebra, anterior view and the lateral view. You can see first vertebra and second is a joint between a first and second is atlantoaxial joint, and the synovial joints in between. These are 7 cervical vertebrae. You see the typical cervical vertebra from above. There is attachment, the spine is bifid a little bit, and there is a foramina in the anterior root through which passes the vertebral vessel. This is regarding the veins of skull, face, and their deep connections with the cavernous sinus. Any of the infections in the facial vein, face, it can connect to the facial is connected with the deep facial vein to superior deep facial vein to thyroid plexus, and then it's connected with the cavernous sinus in between. The retroventral vein is formed with the connection posterior division of the retroband and the facial vein, and these two retromandibular passes through the parotid gland. The retromandibular vein and posterior vein they join together to form the external jugular vein, which opens into subclavian vein. These are the various facial muscles of expression. You can see muscles of mastication are different from muscles of expression. They are highly sensitive. Nerve supply is very high. You can see the frontalis, orbicularis, oculi, corrugator, superior, procinus, compressed nasal nares, tip septi, orbicularis. Then levator levi for the muscles which are around the mouth, around the eyes, and for the eyebrows. These are the terminal branches of the facial nerve which passes through the parotid gland. You can compare it with the five fingers of the hand. Uppermost branch is temporal branch, then zygomatic branch, then buccal branch, marginal mandibular branch, and the cervical is the lowermost branch. This is wonderful diagram. On your right side and left side, right side there is supranuclear. Above the facial nerve nucleus, if there is injury, then that is called as supranuclear paralysis. In that case, eyelid can be closed, both the eyes can be closed, and there is the eyebrows and their forehead can be lifted up. While on the left side, if you see, that is infranuclear paralysis, that is called as facial nerve Bell's palsy. You see the eye cannot be closed on the right side, and right side of the face appears to be paralyzed, while on the left side, that is a normal side of the face, you can close the eyes, as well as the angle of the mouth is lifted up, so the angle dips down on the paralyzed side, and there is eye cannot be closed in infranuclear, that is called as Bell's palsy. While in supranuclear palsy, the only lower part of the face is paralyzed on the opposite side, while in infranuclear, on the same side, it is paralyzed. About the arteries supplying to the face, you get from below, there is a main artery is the facial artery, which has got two branches, the inferior labial, superior labial. Then above the nose, that is lateral nasal. Then again there is a mental vessel. Then from that parotid gland, you see transverse facial and superficial temporal artery. This diagram is showing about the triangles of the neck. It has got anterior triangle and the posterior triangle. The main muscle which divides is the sternocleidomastoid. It is from the mastoid process to manubrum sternum, and anterior to this is the anterior triangle, and posterior to this is posterior triangle. So anterior triangle, the boundaries are the mandible, base of the mandible, the anterior line of the neck, and the anterior part of sternocleidomastoid. And the posterior triangle, the boundary is posterior part of sternocleidomastoid, the trapezius muscle, and below you can see the clavicle. Then again, this anterior and posterior, each triangle is further subdivided into. You can see again the triangles, anterior and posterior triangle. Anterior triangle is further divided into 1, 2, 3, 4 triangles. That is submental triangle. Anterior triangle divided into 4: submandibular triangle, submental triangle, carotid triangle, muscular triangle. Submandibular and submental triangle is formed by division through the anterior belly of digastric and stylohyoid muscle. And from hyoid bone to, you see there are two superior belly of omohyoid and inferior belly of omohyoid. The superior belly divides anterior triangle again into carotid triangle and muscular triangle, and the posterior triangle is divided into supraclavicular triangle and occipital triangle. These are the posterior. Posterior triangle is also called as carotid triangle. The posterior triangle are, you can see posteriorly trapezius muscle, anteriorly posterior body of sternocleidomastoid muscle and omohyoid muscle, posterior belly of omohyoid muscle. The roof, you see the superficial fascia, you see platysma muscle, external jugular vein and subcutaneous branch of carotid and cervical plexus and the deep fascia. And the floor, you can see splenius capitis muscle, ligatus scapulae muscle, posterior scalene muscles. Inferior belly of omohyoid muscle divides this posterior triangle into two smaller triangle, occipital and supraclavicular triangle. What are the contents? You see the artery, third part of subclavian artery, then transverse cervical and supraclavicular. These are the two branches of thyrocervical branch of first part of subclavian artery. Then third part of occipital artery. Vein, subclavian vein, transverse cervical vein, suprascapular vein. Then lymph nodes, supraclavicular lymph nodes, nerve is accessory nerve, branches of cervical plexus of muscles, branches of a loop of C1 hypoglossal nerve, inferior root of ulnar cervical and phrenic nerve, branches of brachial plexus, roots. The anterior triangle, you see it is the anterior midline of the neck, posteriorly anterior border of sternum, and base is lower border of mandible. In pink color, it is anterior triangle. Subdivision, digastric muscles, it divides into four subtriangles. You can see half of the submental triangle, anteriorly, digastric triangle, carotid triangle, and muscular triangle. You can see the submental triangle. The anterior boundary is apex submental. On the other side, anterior belly of digastric muscle. Base is body of the hyoid bone. Floor is mylohyoid muscle. Roof is skin and fascia. Digastric triangle is formed by above and lower border of mandible, below two belly of digastric muscle. Floor is mylohyoid muscle in front, contains submandibular gland, facial artery, common facial vein, hypoglossal nerve, and submandibular ganglia. Anterior lower part is called as muscular triangle. It's bounded anteriorly by midline neck, posteriorly by superior belly of omohyoid, posterior inferiorly by anterior belly of sternomastoid. This one is important triangle called carotid triangle. It is bounded. This is about the investing layer of deep fascia. Its attachment anterior to the mandible, then hyoid bone, then the sternoclavicular joint, then the clavicle and posteriorly midline of the neck and a supranuchal line. Then the posteriorly again it is attached to the mandible mastoid process supranuchal line. Deep fascia is also called as fascia cola. It is condensed to form following layers: investing layer anteriormost, pretracheal fascia, prevertebral fascia, carotid sheet in between, buccopharyngeal fascia and pharyngobasilar fascia. The investing layer is deep to platysma and surrounds the neck in the form of collar. It forms the roof of the posterior triangle. Then you can see attached superiorly to the external occipital foramen. Just now we have seen investing layer of deep fascia. Then you can see the pretracheal fascia. You can see it is attached superiorly to the hyoid bone, then inferiorly to cricoid cartilage. Then it encloses the thyroid gland, and inferiorly it merges with the fascia of arch of aorta. This is the pretracheal fascia. Behind this is buccopharyngeal fascia. Buccopharyngeal fascia, then behind buccopharyngeal fascia there is prevertebral fascia. This diagram shows the supermost layer, that is of the deep cervical fascia, that is investing layer, which encloses the parotid gland as well as submandibular gland. These are the structures seen in the roof of the posterior triangle. You can see the nerves as well as external jugular vein draining into subclavian vein, anterior cutaneous nerve, greater auricular nerve, lesser occipital nerve, and supraclavicular nerves. The carotid sheath is a condensation of fibroareolar tissue around the main vessel of the neck. It is formed on the anterior aspect by pretracheal fascia and the posterior by prevertebral fascia. It contains common or internal carotid artery, internal jugular vein, vagus nerve. It is a thin over the vein. And upper part of the sheath there is 9, 10, 11, 12 nerves. These nerves pierce the sheath at different points. Ansa cervicalis embedded in the anterior wall carotid sheath. Cervical sympathetic chain is also seen. The sheath is overlapped by the anterior border of the sternocleidomastoid in fused layers from the deep cervical fascia. This diagram is showing the level of hyoid bone around C3 level, then the thyroid cartilage C4 level, and the cricoid cartilage at C6 level. The suprahyoid region showing contents of submental and digastric triangles. You can see submental triangle with anterior jugular vein, then the submental lymph nodes. This is the coronal section from the floor of mouth. You can see superficial part of submandibular cervical gland and deep part, which is mylohyoid muscle divided into, and you can see again this investing fascia. There is 12th nerve is passing and lingual nerve is near the styloplexus muscle. Here you can see in between the hyoid bone and the sternum there is a cartilage called thyroid cartilage, and so these strap muscles which are passing directly from the sternum to the hyoid bone, these are called as sternohyoid muscle, and which are passing from thyroid cartilage to hyoid muscle. You can see that is thyrohyoid muscle, then sternum to the thyroid cartilage, that is sternothyroid. So first is sternohyoid, then below that thyrohyoid and sternothyroid, then behind this you get omohyoid muscle, superior belly and inferior belly of digastric, or inferior belly of omohyoid. So again the triangles of the neck: anterior triangle, posterior triangle. Anterior is 4 triangles, for posterior is 2 triangles. This is showing the floor of the digastric triangle. Again you can see the anterior belly of digastric, posterior belly of digastric, mylohyoid muscle, floor of the tongue. This figure is showing the carotid triangle, the contents and the important structures. So that's why carotid artery is the main structure, most important structure, which branches into external internal carotid artery. Then the nerves, important nerve passing through is the 10th nerve, vagus nerve. Then the branches of 11th accessory nerve, the branches also passes through it. The ansa cervicalis, superior root of ansa cervicalis arches from this, and the carotid, external carotid, branches of external carotid artery are also seen in this carotid triangle. The anterior triangle, lower part is muscular triangle, so all the muscles called strap muscles are seen. Ansa cervicalis is a thin nerve loop that is embedded in the anterior wall of carotid sheath over lower part of the larynx. It supplies the infrahyoid muscles. It is formed superior and inferior root. The superior root is continuation of descending branch of hypoglossal nerve. Its fibers are derived from first cervical. Inferior root from the descending cervical nerve is derived from second and third cervical spinal nerves. Superior root supplies to superior belly of omohyoid. Ansa cervicalis to sternohyoid muscles. Inferior root to inferior belly of omohyoid. External carotid artery, the branch is lingual artery is the branch of external carotid artery. It crosses through the hyoglossus muscle, and then it rises up and deep convert into deep lingual artery. It has supplies to genoglossus muscle, and it is crossed by hypoglossal nerve in the lower side and the lingual nerve on the upper side. So this is crossed 2 types. Submandibular ganglia is writing below above the hypoglossal muscle, and 3 nerves are there. That is, one is lingual nerve, another is 9th glossopharyngeal and hypoglossal nerve. This is the cross section of the capsule of the parotid gland. It is enclosed into the investing layer of deep cervical fascia. First is anterior sternocleidomastoid muscle is there, then superficial fascia and the stylomandibular ligament. Posteriorly it is attached to a styloid process, anterior layer to the zygomatic arch, and above this you can see external carotid piercing the stylomandibular ligament. Then you see the parotid fascia is lying on the platysma muscle is above that, and parotid gland contains the facial nerve superficial to retromandibular vein. The structures that arise at the periphery of the parotid gland. Anteriorly, you can see 5 branches from the facial nerve. Then parotid duct is there, and below you can see the veins, the common facial vein, and anterior posterior divisions of retromandibular vein. Then posterior auricular vein. Then on the superior side, you see superficial temporal vessels, arteries, and auriculotemporal nerve and posterior auricular vessels and nerve. Diagram is the cross section in the parotid gland. You can see the superficial lymph node, then parotid fascia. Then the facial nerve is crossing from deep to the superficial side, and it comes over the retromandibular vein. Then below retromandibular vein there is external carotid artery. Then after that deeply there is styloid process, and behind that there is internal carotid artery and internal jugular vein. You see this artery, vein and nerves behind the parotid gland. Parasympathetic nerve supply are secretomotor, and they reach the gland through auriculotemporal nerve. The preganglionic fibers begin in the inferior salivary nucleus, pass through the glossopharyngeal nerve, its tympanic branch, the tympanic plexus and lesser petrosal nerve relay in the otic ganglion. Postganglionic fibers pass through auriculotemporal and reach the gland. Sympathetic nerves are postganglionic, vasomotor, and are derived from plexus around the middle meningeal artery. These fibers form lateral horn of T1 segment small cord. They synapse in the superior cervical ganglion. Postganglionic fibers travel a branch of external ganglion and through middle meningeal artery. Sensory nerves to the gland come from auriculotemporal nerve, but parotid fascia is innervated by sensory fibers of greater auricular nerve C2 and C3. This diagram is showing the openings of the parotid duct and submandibular duct. Parotid duct opens at the opposite crown of upper second molar tooth in a gingivo-buccal vestibule, and submandibular opens below at the frenulum. This diagram is to understand the muscles of mastication. There are 3 muscles of mastication, more important. These are masseter, temporalis, lateral and medial pterygoid. The temporal muscles, the origin is from the superior layer, from the largest into 2/3 of the zygomatic bone, middle layer from the zygomatic bone and deeper, and fibers pass downward by 45 degree, insert on the superior layer on the lower part. Lateral ramus of mandible. Nerve supplies mandibular nerve anterior division. It elevates the mandible. Then temporalis muscle again elevates the mandible. It's the temporal fossa, and it is inserted into the anterior mandible. Lateral and medial pterygoid depresses the mandible. Lateral pterygoid depresses and medial pterygoid elevate the mandible. The muscle which depresses the mandible is lateral pterygoid. This is to understand the branches of maxillary artery. This is the third part of maxillary, first part, second part and third part. You see from the first part, the branches are first part of deep auricular, anterior tympanic, middle meningeal artery, accessory meningeal and inferior alveolar. Second part is shown in the green color. It is supplying to the masseter muscle, deep temporal, pterygoid and buccal. Third part is shown in the red color, superior alveolar artery, inferior orbital, greater palatine, pharyngeal artery of pterygoid canal and sphenopalatine. Here you can see from above downwards, in the center there is foramen spinosum through which middle meningeal artery goes inside the skull. Behind you can see the maxillary artery. Then Another is the middle meningeal artery, maxillary artery, and lower down is the inferior alveolar artery. And anterior to the foramen spinosum, there is foramen oval through which mandibular nerves comes out, and it has got a lingual branch and alveolar branch. This diagram is showing the two nerves. Facial nerve is above the temporomandibular joint, and auriculotemporal nerve is deep to temporomandibular. This is the distribution of mandibular nerve, third division of trigeminal nerve, that is mandibular. It divides into two main branches. One is lingual nerve and another is inferior alveolar nerve. And use one more called the tympani. Then this supplies, the mandibular nerve supplies muscles of masseter nerve, temporal nerve, and nerve to lateral pterygoid. Then it again supplies the buccal nerve. These are the muscles of mastication. Then medial pterygoid is supplied and tensor palatii is also supplied. Then the lingual genoglossus and hyoglossus, lingual nerve supplies the upper muscles of the tongue, and the floor of the mouth again is supplied by nerve to mylohyoid through the inferior alveolar nerve, nerve to anterior belly of digastric. Otic ganglion is peripheral parasympathetic ganglion which relays secretomotor fibers to parotid gland. It's related to mandibular nerve, but functionally it is a part of glossopharyngeal nerve. Its size is 2 to 3 centimeters, situated in the infratemporal fossa just below the foramen oval. It lies medial to mandibular nerve and lateral to tensor palatii. Connections and branches. Secretomotor or parasympathetic root is formed from the lateral petrocellular origin is shown in the. So how it is arising? Preganglionic fibers of inferior secretory nucleus through ninth nerve, tympanic branch, tympanic plexus, lesser petrocellular nerve to otic ganglion. Post-ganglionic fibers join auriculotemporal nerve to supply to parotid gland. Sympathetic root is derived from plexus on the middle meningeal artery, and the sensory root comes from the auriculotemporal nerve. This is showing the relation of marginal mandibular branch of facial nerve to submandibular gland. You can see the facial vessels near this submandibular gland, and the nerve is crossing. Facial artery is between the gland and angle of mandible, and the nerve which is crossing is marginal mandibular branch of facial nerve. This is cervical branch of facial nerve goes down, marginal branch up. This is a diagram showing submandibular region, showing superficial relations of hypoglossal and genoglossal muscle. The deep part of submandibular gland is seen, submandibular ganglion is seen. You can see lingual nerve, glossopharyngeal nerve, accessory nerve, hypoglossal nerve, not accessory nerve. You can see the relation of facial artery and facial vein. Facial artery goes deep, forms the S loop, and vein directly above that. And in the another figure, you can see this muscle, mylohyoid muscle, divides the mandibular gland, superficial part and the deep part. Apply to submandibular gland and the sublingual gland. It has got supply branches from secretomotor. Secretomotor, they are coming and fibers, superior salivary nucleus, facial nerve, chorda tympani, joins lingual nerve, branch of V3, submandibular ganglion, then release postganglionic fibers to submandibular and sublingual glands. The submandibular ganglion is a relay station. From the secretomotor roots, they are coming from chorda tympani to facial nerve, while the sensory fibers are from the lingual nerve, and vasomotor sympathetic fibers from the plexus around the facial artery. This is about the blood supply for the thyroid gland. The superior thyroid artery is a branch of external carotid artery, and inferior thyroid artery is a branch of thyrocervical trunk from both sides, which are the branch of subclavian arteries. These arteries, after giving branches, superior thyroid pierces the pretracheal fascia, reach apex of the lobe where nerve divides midly. At upper pole, artery divides into anterior and posterior branches. Anterior branch descends on the anterior border, and posterior branch descends on the posterior border. You can see on the other diagram These are anterior and posterior branches, and inferior thyroid artery is multiple branches. The venous drainage superior and middle thyroid veins, they drain into internal jugular vein on both sides, while the inferior thyroid veins, there are small multiple inferior thyroid veins, they drain into left brachiocephalic vein. Obstruction to subclavian artery proximal to origin of vertebral artery may lead to stealing of the blood from brain to the opposite vertebral artery. This may provide necessary blood to affected site, and nervous symptoms include subclavian steal syndrome. Basically, the supply to brain is reduced, and there is circulation of the blood from vertebral artery of the opposite side. It goes back to the vertebral artery of this side as the vein is, and then on the another side.